So you had a dental implant placed and it feels like something is not quite right. Do you know that there are signs that the dental implant is failing or in the process of failing, even years after that implant was placed? Hi, I'm Dr. Fernando Verdugo, American board certified periodontist since 2003, clinician, researcher, and published author. And today we're going to talk about some of the most common signs and symptoms of a failing implant or an ailing implant, that is an implant that is in the process of failing, and what we can do about it. Sign number one, bleeding or inflammation of the surrounding mucosa, that is the gum tissue that surrounds the implant. Basically, there should be no bleeding or inflammation, no redness of the soft tissue surrounding that implant. It should look natural, pink, firm, basically pretty much like the adjacent teeth. Sign number two, persistent pain. While it's normal to have some discomfort right after the implant has been placed within the first week or two, that discomfort should diminish, and by the first couple of weeks it should be gone. So if there is any persistent inflammation, redness, pain, that could indicate that there is basically an infection or perhaps damage to some vital structures. Sign number three, difficulty chewing or discomfort when eating and biting. This could be related to a poor crown design or poor crown fit. Oftentimes redoing or adjusting the crown or simply adjusting the patient's bite may solve this issue altogether. Sometimes it may be just simply lack of osseointegration of the implant. Sign number four, the implant is loose. A healthy osseointegrated implant should not be loose. When there is a healthy osseointegration, that means the bone has surrounded the threads of the implant. Basically, that implant is solid and stable within the jawbone. If it's loose, it has lost osseointegration, in which case the implant should be removed. It is common to see loose crowns after a while in function. We have a screw retain and cement retain crowns. Both can actually become loose. If that is the case, after taking an x-ray, there is no signs of radiolucency around the implant and the bony levels look healthy. Most likely what is happening is that that crown became loose. So if it's screw retain, we need to retighten that crown. If it's cement retain, all we need to do is re-cement the crown. But always make sure that the tissues around that implant are healthy. There is basically no bleeding upon probing or no pocket formation. This patient came to me because her implant was loose. The patient didn't have any pain or apparent signs of infection. The patient had the implant placed by her general dentist about 7 months prior. The patient had had a socket graft with a bone substitute right after the tooth extraction. Shortly after, the implant was placed, and in about 7 months, the implant became loose. The implant becoming loose so early in the game denotes basically a lack of osseointegration, possibly due to the lack of new bone formation after the tooth was extracted, which happens when a bone substitute is placed inside the socket. Human research has shown that grafted sockets can have up to 60% less new bone formation than non-grafted sockets. So basically, by grafting a socket, and that depends also on the bone substitute use, we are going to see a reduced new bone formation, which could impair osseointegration and hence we could have basically an implant that is loose or moving shortly after it has been placed. This was considered an early failure. I basically had to remove the implant, clean out the socket, degranulate it really well, make it bleed, make it healthy again, and sometimes we can either place the implant at the same time, or sometimes it is recommended, depending on the defect anatomy, depending on the anatomy of that socket, we may have to wait for new bone formation to occur. If you follow the natural principles of periosteal guided bone regeneration, you can definitely shorten healing times and boost new bone formation intra-socket. Basically, we can decrease cost and morbidity for your patients and your practice. If you like this information, please subscribe, leave your comments and thoughts underneath, and ask any questions if you have one. In the next videos, I'll be showing how to boost healthy new bone formation for successful and long-term clinical outcomes, avoiding the need for bone substitutes, and achieving a healthy and long-lasting osseointegration. Goals, the main goals, and again, how we can prevent these biological complications. Well, number one, I want to have my implant fully surrounded by autogenous bone. I want to improve the bone to implant contact. So in doing so, I'm going to make sure that the whole perimeter of my implant is surrounded by autogenous bone.